Hello everyone, I'm Reena Anthony, graduate student at West Texas A&M University. I plan to present today a topic on ransomware in healthcare. Today I will cover what is ransomware, its life cycle, the effects on healthcare sector, what are the risks, what we can do to prevent and mitigate them, and how we are going to detect a ransomware. What is a ransomware attack? It's a type of malicious software that is normally induced by cyber criminals by sending out phishing emails that may have a link or a code. Once the user clicks this link, the code encrypts all files and network drives, shared devices, storage devices that the user has access to. Once encryption has been completed, the ransomware informs the user that a huge amount has to be paid in exchange for the decryption key. The different forms of ransom payment are Bitcoin and cryptocurrency. Why is this on the high rise? This is probably because of easy access to a business model called as RAAS, otherwise known as ransomware as a service, which is offered for a fee by the dark web. There are also do-it-yourself kits that are now sold in underground markets. There are also free open source ransomware code that's available on web repositories. Some of the major ransomware attacks that happened during 2017 to 2018 were WannaCry, CryptoLocker, Zepto, Petya. So to summarize, the entire life cycle of a ransomware begins with the inception process, where a target is identified by a cyber criminal, followed by infection of the target's files or systems, followed by complete encryption, where the access to these files and systems are completely blocked, which is then followed by the extortion, request for payment in bitcoins or cryptocurrency. And once that's made, an extraction process follows if a decryption key is provided to unlock these files and systems. So during my search in Google, I realized that healthcare is definitely one of easy targets for ransomware attacks. Why? And this is because it's a giant industry comprising of the total number of hospitals in the United States of about 6,210 as reported by AHA in 2019. There are innumerable patient EHR records that comprise data more than 180 million from different sources such as hospital admissions, doctors' visits, pharmacies, insurance carriers, etc. Of these, 90% of the hospitals have digitalized their health records. Hospitals are so much technology dependent, especially for diagnostics, virtual doctor care, lab reports, bedside point of care systems, implanted services, automated communication of fitness counts, or blood sugar monitoring. The reason healthcare system is really impacted is because of their legacy systems. It involves a huge amount of time, cost, as well as resources in order to upgrade these legacy systems. And so due to the interconnectivity between various departments of a hospital or a medical center, they do have complex networks. So in order to find low costs as part of security fixes, there are a lot of band-aid patchworks done. There is a lot of lack of up-to-date security threat and lack of training for employees who are not aware that by clicking an email, it could be infecting a complete network. Due to interconnectivity between different health industries like pharmaceutical industry, insurance industry, if one of them is infected, then the chances of the remaining two getting infected is very high. What are some of the risks of such attacks? Definitely patient health and safety. Loss of a patient's EHR records could impede a doctor's ability to treat his patients. Lack of control over essential medical equipment definitely endangers a patient's life. Also, with respect to regulatory compliance, if there has been a ransomware attack on a covered medical entity or on personal health information, these are identified as a HIPAA breach. What are some of the financial implications? Definitely a huge ransom payment in exchange for the decryption key, which is not a guaranteed one. There is also cost involved in backup data restoration, which involves a lot of time and resources. Patients could also raise lawsuits with medical centers and hospitals where they do not have access to their documents, and so there is a lot of legal fees involved in dealing with such lawsuits. There is also a fine levied by the HIPAA regulation, which is varying from $100 to even up to $1 million, which is huge. There could also be business interruptions, due to which patients cannot be visited by a doctor, as the doctor is not able to access his systems. There are also other extra expenses involved. As per the HIPAA regulation, there needs to be notification sent out to patients if their data has been compromised. So how can we prevent and place a mitigation strategy? It is good to have automated data backups locally as well as offsite. It would be ideal if we could have multiple copies of our data so that we do not have to pay these ransom payments when we have data to restore. It is very important to avoid any kind of band-aid patches for security fixes. Let's upgrade our legacy systems to more technology advanced systems so that we can prevent these kind of issues. It's very important to educate and train our employees, especially on phishing emails and latest security threats. Many times it has been identified that the source of this attack is probably because an employee did not know that they were not supposed to click that link. It is important to have control access to data. Let's not give unauthorized access to anyone's data. It would be ideal if we do not have to pay the ransomware, because as more payoffs, it encourages further and multiple attacks on the same systems by these cyber criminals. We need to improve our security systems. We need to start monitoring all emails, any kind of behavioral issues with our networks, try to add additional security layers, example duo authentication. Try to have firewalls so that our email and gateways are protected. Try to have segregated networks by segmenting different zones of network, which is part of our network protection strategy, and also have server protection and do necessary upgrades if those are required. So how do we defeat ransomware? Let's go through some of the steps. First, isolate the infection. Isolate the infection completely from spreading other systems. 2. Identify the infection. Find the type of malware strain and see if there is an antidote for it. Number 3. Report the ransomware. It is important to report to the authorities, especially HIPAA, in case there has been breaches of data leaks. Number 4. Determine what our options are. Try to find out from the cybersecurity team what are our options and if we have to follow what the ransomware asks us to do. Number 5, restore and refresh. If we do have backup data, definitely restore safe backups to the point where users are able to start working again. And number 6, plan to prevent such occurrences again in future by assessing the type of infection, the cause of infection, and what measures can be put in place from happening again. As part of my analysis, I did find that security breaches are going to cost healthcare organizations almost $6 trillion by 2020. That's huge. So let's summarize. What's a ransomware? It's a malware, or otherwise called as a crypto-viral extortion. What are the different modes of attack? They could send links through phishing emails or embedded codes through network hacks. Who are easy targets? Healthcare being number one, only because of massive volume of data and because the data is so much worth. What are some of the risks? Loss of data, money, and life. So what is my recommendation to all of you? Prevent it as much as possible by implementing good mitigation strategies. Detect them by monitoring on a timely fashion. Once you detect them, definitely respond to them as quickly as possible and learn from them. Let's not get attacked again. Thank you everyone. Hope you all have understood as much as I've learned. If you have any questions, please post them on the forum and I shall get back to you to the best of my ability. Thank you.